We are running a robust surveillance COVID-19 program. We participate in the Broad Safe for School program, and we are testing all of our campus community members, looking to detect COVID-19 in people that may not have any signs or symptoms.
That's a really different concept than diagnostic testing, where someone only gets tested if they have symptoms and think that they might have COVID-19. Because we test everyone once or twice a week, we're seeing more positives because we're catching cases early. We're catching cases that may never develop symptoms. We're catching cases before they develop symptoms. And that's the beauty of surveillance testing. It allows us to find all of the positive cases and find them early before they have the chance to spread to other people. That means that we're going to discover more positives, but those positives are there whether we find them or not.
When we find a positive result in our campus community, we undergo contact tracing, which is guided by the Massachusetts Department of Public Health and CDC guidelines. The positive case is contacted and interviewed, and we try to figure out where that positive person may have come in contact and developed that infection for themselves. We also take them through an interview process to try to identify who may be considered a close contact of that positive person, to know who may be at an increased risk of becoming infected themselves. When somebody is determined to be a close contact means having spent more than 15 minutes with somebody who's been infected less than 6 feet away. We look to try to identify all close contacts that have been around someone who's been infected within the past 48 hours prior to them testing positive or prior to somebody becoming symptomatic. People that are identified as infected are put into isolation for 10 days. They need to stay separated from all other people for a full 10 days so that they are no longer contagious. People that are deemed a close contact of somebody are at risk of developing the infection within their body over a 14-day period of time. It's important that people that are considered a close contact stay away from other people for the full 14 days. Even if they get a test while in quarantine and are determined to be negative at that test, they still need to maintain quarantine for 14 days because it is still possible for the infection to be developing over that 14-day period of time.
The evidence that we've collected so far through our surveillance program has showed us that there's no evidence of spread of COVID-19 occurring in our classrooms. That means that our classroom safety policies are working and they're keeping the most vulnerable members of our faculty, staff, and student communities safe. They're also showing us that the number of close contacts that students have is growing. And that's natural, right? As students get to know each other over the course of a semester, it's easy to expand the number of people that you come in contact with on a regular basis. But this knowledge helps us course correct. It helps us understand how we can reach out to students and educate them around why it's so important to minimize the number of close contacts that they have and continue to practice social distancing and hygiene practices. We're so proud of the efforts of our faculty, staff, and students to keep one another safe here on the Merrimack campus. But it's important to remember that it's not over yet. As the weather gets colder, we really need students to continue to limit their close contacts, always wear a mask, and wash their hands. Please try to stay outside to socialize and continue to be vigilant. Remember that the safety of vulnerable members of our community depends on you.